As you just heard, this webinar is being recorded, and I will provide more information regarding that in just a minute. Alrighty, well, while a few more people trickle in, I'm just going to go ahead and get started as it is 1 o'clock. Thank you very much for joining us. We're excited that our webinar series has started again post-conference. If you attended, we hope you enjoyed this most recent conference in Richmond. We're very grateful to Virginia Housing for sponsoring this webinar series. Today, we have Karen McPhail of Elementals LLC, who will be discussing how to effectively support the aging and care needs of LGBTQ plus older adults. So we're really excited to have Karen here. Karen was originally scheduled to speak at the conference, so we're glad that we're able to host her here. We really encourage questions. There will be a Q&A portion at the end of the webinar. So if you want to go ahead and submit questions, please submit them using the Q&A feature rather than the chat feature, just to help Karen keep track of all the inquiries. Also, you may use the raise hand feature to request to be unmuted during the Q&A portion as well, if you would like to pose your question live. But I'm going to hand it over to Karen at this point. Thank you, Karen, for joining us as speaker.
Excellent. I'm going to go ahead and screen share, if you'd allow me that capability.
Yes.
Thank you.
You should have that ability.
Excellent. Thank you. Excellent. 1 second, so I can just push simply play. Wonderful. Hopefully everyone can see the cover slide. Well, thank you so much for having me today, Jillian. I think you gave a very nice overview. This is a little bit about me, and I do share a little bit more on my slides today in terms of content, because you are welcome to request these at the end of the program. I'm happy to share this information. And there's also an article that I had, a recent feature article in the American Society on Aging on solo aging from a care management perspective in the LGBTQ plus aging community. So that's also a great resource if you'd like to check that out. It is online through the American Society of Aging summer issues. But enough about me. So some of our presentation goals for today really are to form a clear understanding of LGBTQ plus history, because I really like to use this as a starting point for education. I think it helps individuals to understand why we have certain challenges in our LGBTQ plus older adult community, and it helps to really be a starting point for learning. Hopefully everyone will come away with this by understanding the present day challenges of LGBT elders in terms of treatment, care, and other just holistic health and wellness challenges. And also understand the inclusive care components really for best supporting those in the community, have an increased empathy and awareness of these challenges, and have some applications really to take forward to make things more welcoming in terms of services and healthcare provisions. One piece also that I want people to have a better understanding of is just the basic terminology. I'm not going to spend a ton of time on this, but I will have full definitions for reference. Obviously, I think gender identity and sexual orientation are very important for people to understand. Sometimes I find this can be confusing for individuals, so we'll touch on that. And then I'm hoping that everyone comes away from this presentation understanding that really there are certain health disparities, and hopefully people can determine and describe at least 2 LGBTQ plus health disparities in aging and the long-term care continuum. So, hopefully everyone will be able to do this, and also identify some strategies for making the needs of LGBT elders, more welcoming, and understand how to make active steps to improve these. So let's start off with some basic terminology. Gender identity, sexual orientation, the term lesbian, bisexual, gay, transgender, and of course, the umbrella term of queer. We're going to go over these just briefly as a starting point, as I may use some of these throughout. So I do have a ton of information on these slides, and generally I'm sort of a less is more approach, but I want to make sure at the end of this presentation, you have a good reference. You can take a look at these items and use them accordingly. So the term queer really is something we're going to discuss more as I talk about terms as they apply to LGBT elders, but it's any orientation or identity that's not considered straight, can be considered queer. It's really an umbrella term for being part of a larger queer umbrella. We'll go into this a little bit more in the presentation. Bisexual, of course, describes a person who's attracted to both men and women. This is sort of a basic term to go over. And I have a little bit more content, of course. Cisgender is someone whose gender identifies or matches with their sex at birth, male or female. Someone who's considered really straight is cisgender. Gay describes a person who's attracted emotionally, physically to someone of the same gender. Lesbian describes a woman who's attracted emotionally, physically to other women. And then we're going to move on to sexual orientation a little bit, which refers to a person's sexual, emotional, or physical romantic attraction, non-attraction towards a person of the opposite sex, same sex or gender, to both, or really to none, is how we define sexual orientation. And really it is a fluid process. I try to explain to people when I'm teaching that one's sexuality, sexual orientation is fluid. And just like we change across many areas when we're aging, we also change in terms of our sexual orientation and how we oftentimes identify. We evolve and change over time. This is fluid. And it encompasses various areas, including gay, lesbian, heterosexual, bisexual, pansexual, asexual, or more. So when we talk about some of this, it can become confusing for individuals. And I get a lot of questions about gender-related terms. And we could talk about this a lot, but we'll touch a little bit on gender expression. And really, it's how individuals communicate their gender to others through a variety of mechanisms. And gender expression is not the same as gender identity. Gender identity is really a person's internal identification as male or female or something in between or something other than the two conventional gender options. And oftentimes a person's gender identity really isn't always visible to others and can match or differ from their assigned sex at birth. So this is something that really oftentimes needs clarification for a lot of people when I am doing teaching. So I did want to touch on that briefly. Now, transgender describes a person whose gender identity or gender expression does not match their assigned sex at birth. So transgender individuals may be also straight, they may be lesbian, they may be gay, they may be bisexual or queer. So, it really is something that encompasses many areas. Intersex, which can be confusing as a term for many, and many people don't always know what intersex means. It really is different from transgender, as it describes a person born with sex characteristics that are not typical male or female. Every intersex individual is a little bit different. And how this presents itself. Sex characteristics are physical features relating to sex, including chromosomes, genitals, hormones, and other reproductive anatomy. So, really intersex is a bit of an umbrella term also. And intersex characteristics and traits are not always apparent at birth. We find people really finding out sometimes in their adolescence and even in adulthood that they are intersex. So now that we've gotten past some of the basic terms, I want to be able to discuss language as it relates to LGBTQ plus older adults, and why sometimes we will hear people say LGBT and we'll hear them say LGBTQIA plus, etc. Oftentimes we'll say LGBT because the word queer for some and not all older adults can be an insult. It's not a term that in the past was viewed in a positive way. And it wasn't really until the late 80s that the LGBTQ plus community started adopting the term as a form of pride. You see the LGBT youth really recapturing or reclaiming this term, but it can still be distasteful to some older adults in the community. So, I try to avoid the term unless I hear them using the term in a positive way. Also, the term homosexual is a very derogatory term for most older adults, based on things from the past. So we want to make sure that we're sensitive to terms that can trigger past trauma. We're going to talk about trauma a little bit later in the presentation, but it's important to be familiar with key terms, understand the importance of using proper terminology, understanding proper terminology, seeking clarification when you need it, and avoiding gendered language and the use of proper pronouns is key. And I do advise everyone to take a look at, just do a search online of gendered language. And I think you may be surprised that during the day, you may be using it more often than you realize. So it really is important to make sure that you understand these aspects, because we hate to do something that could be triggering or upsetting for another. So why is it important to understand the needs of LGBTQ plus older adults? A lot of times I hear in education, I don't get it. They're aging just like anyone else. What would be the problem? Well, I think it's important for people to understand that there are significant differences. Aging is difficult for everyone. It's not a simple process. It's not easy, but it is a little bit more challenging for those presently age 65 and above in the LGBTQ plus community due to a variety of reasons. And part of the reason why I want you to understand it's important is because we also have a growing population. Right now between the ages of 18 and 23, they're calling it the gayest generation. I think 48%, of this population, really younger early adults, are identifying as part of the LGBT community. So, for the future, we need to understand what inclusive care and services look like. But we also have a growing older adult community right now. We don't have really super clear numbers in terms of census data on older adults in the LGBTQ plus community, but in terms of various estimates, we have around 3 million individuals identifying over the age of 50 and 2.4 over the age of 65. Now, I think those numbers are very much skewed down because this generation is not honestly super good at disclosing. And you'll see the variety of reasons based on the history for this and why I do make this little bit of an assumption that the numbers are probably lower than we're estimating. But either way, irrespective, the numbers are supposed to double by 2030. And I do think that is realistic. We do have a growing older adult population. And it's important for us to understand their needs, not just because of growth, but because of complexity. These individuals, this population now, has seen monumental changes across their lifetime. They were born at a time when same-sex activity was illegal in all 50 states. They have a lot of past trauma as a result and more concerns as an aging individual than our traditional older adult. So it's important to recognize that. And yes, over the years, this talk will change because we're going to have much different challenges for the next generation. But I'm presenting to you what we have today. So some of the common challenges faced by older adults in the LGBT community. Some basic pieces are they are twice as likely to be single as they age. And this is due to a variety of factors across their lifetime that we'll continue to discuss during the presentation. They're 4 times less likely to have children, so they have less support. They're often estranged from their families of origin. They're twice as likely as a result to live alone. A third of the population live in poverty and have financial hardship or housing hardship. And across the population, many are less likely to access preventive health measures, less likely to disclose orientation in healthcare settings and to service providers. They generally do not do good planning for a variety of areas in terms of of long-term care, legal, executing necessary documents for aging in terms of power of attorneys and other necessary items that will provide them with proper support and advocacy. And a lot of this is due to a general mistrust of government and healthcare providers due to past experiences and ill treatment and discrimination. And we'll go over a lot of this as we continue on and why it is often more challenging for LGBT older adults. So when I educate, I generally like to use history as a starting point for learning and for understanding. And this is a photo of the Stonewall Uprising from 1969. And this is really known as the beginning, the start of the gay liberation movement. I'm going to use a case study for you of a very significant figure in LGBT history, Edith Windsor. And Edith Windsor was a gay rights activist. Her landmark case really led the Supreme Court in granting same-sex marriage to couples and federal recognition for the first time. So I think Edith is a very good, influential character to start with, and to be able to guide you through this process. You can see what Edith throughout her lifetime lived, what she experienced, and how perhaps if you put yourself in Edith's place, you would feel at the end of this after all of a lifetime lived. So Edith Windsor was born in 1929, and in her lifetime, she saw monumental changes, and she really influenced some monumental changes also through her work. But just to give you a flavor for this, in 1952, the American Psychiatric Association's Diagnostic Manual, the DSM, listed homosexuality as a sociopathic personality disturbance that could perhaps be treated. And during the 1950s, you also saw an executive order issued by the president, President Eisenhower, banning homosexual gay individuals from working for the federal government, stating that they posed a security risk, a national security risk. We also have the McCarthy trials targeting sexual perverts for harassment and termination from government jobs. Edith is 24 years old while all this is unfolding around her. Imagine how Edith felt. In 1969, we finally see the Stonewall Uprising and the beginning of the gay liberation movement many years later. Now, Stonewall is the response to an unprovoked police raid in Greenwich Village, New York on early Saturday morning. Over 400 LGBTQ plus people protested their ill treatment and pushed the police away from the area. Rioting continued over 6 nights, which closed the Stonewall Inn. And this, again, I ask you all to please take a minute to look up the Stonewall Uprising. Look this up and read about it. Learn about LGBT history, because this was a pivotal defining moment for LGBT history. And again, the beginning of the gay liberation movement, which we see Edith Windsor at the age of 39. Moving on. In 1973, the American Psychiatric Association finally removes homosexuality from its list of mental health disorders. Edith is 43 years old. She's middle-aged. She's lived decades of her life thinking or being treated as if she has a mental health disorder due to how she feels and how she is trying to live authentically as an individual. In 1981, you see the beginning of the AIDS epidemic with first reported cases coming in. We have 583,000 men and women in the US dying from AIDS through 2007. There's a lot of survivor guilt associated with this, a lot of loss, a lot of hardship, a lot of discrimination that occurred during this time period. And then in 1996, we have Congress passing the Defense Against the Marriage Act, which prohibited the federal government from recognizing same-sex marriages. Individuals across the US were unable to work or unable to rather live authentically, unable to get married, like many of us just take for granted the right to be able to do so. And then we have 1998, targeted violence against Matthew Shepard, a gay American student at the University of Wyoming, being brutally beaten and left to die. Edith is 69 years old. She's approaching her aging in senior years with all of this coming to a head, never being able to have a life partner or being married, being at risk for violence, discrimination, and all of this at the age of 69. When you start to really reflect on how you're going to age, how you're going to be cared for, and maybe even starting to have some chronic conditions or other complex problems. So you see Edith Windsor having a lifetime of challenges and changes. Look at all of this. We don't see until the 2000s with the Stonewall National Monument first coming in as a national monument for LGBT rights. We don't see into 2016 the Pentagon announcing a lift on the ban for transgender people serving in the military, which is still a challenge in present day. And, we don't see until 2016 Edith Windsor being able to marry at the age of 87, and then she passes away at the age of 88. So there's a lot going on across her life, that we see. And I continue the timeline here. Sorry, it's a little bit out of sorts in my slides. I apologize. But, we really see her continuing into her elder years, pushing forward and repealing Section 3 of the Defense Against the Marriage Act at the age of 83. And then in 2015, we finally see the Supreme Court rules in favor of same-sex marriage. Edith is 86 years old. And she's having to struggle, and she's having to push, and she's having to fight to be recognized, to be allowed to live authentic, things that many of us across our lifetime take for granted. We don't think about, we don't even have it cross our thoughts at all, because we enjoy all of those rights without even a blink of the eye. So we see more happening across the 2000s with US Supreme Court invalidating the remaining laws that had criminalized same-sex acts, and again, the Stonewall Monument, and some great changes. But really across all of this, and even to today, there is more anti-LGBTQ plus legislation than pro to present day. And we see a step forward and a step back continuously across the 2000s into present day. More work needs to be done, clearly. So the takeaway from all of this, as we go back to just LGBT aging, is that these older adults have clearly seen monumental change. They were born at a time when it was a challenge. They came of age at a time of great prejudice, legally and medically sanctioned discrimination and violence against them, and at times medical labeling. Being medically labeled inappropriately as having a mental disorder. And this validated the prejudice, the insecurities, the inappropriate, at times ill treatment, and thoughts of inadequacy, and fear. So many of these individuals have lived for decades in fear, oftentimes in isolation, and oftentimes also being dismissed by families of origin. So 2 to 3 times more, they are likely to live alone. And all of these social pressures have caused a lot of things to unfold holistically for LGBTQ plus aging. Many individuals have, again, a profound mistrust of government health and social programs, and they won't access them, which creates big problems across the board. We're not giving them good preventative health. We're not addressing challenges that could really be impacted early on and meet with better health and wellness outcomes. So because they're reluctant to this, they're also reluctant to opening up about their LGBTQ plus identity. So oftentimes they're underserved or not thought about in the mainstream aging movement, or even at times, sometimes even in the mainstream LGBTQ plus movements. Many have survivor guilt from the HIV and AIDS epidemic and persistent worry and stress about multiple holistic health disparities because they just don't feel comfortable moving forward. They feel stuck. So really, this is a continuing dysfunctional cycle that just moves on, and really this long-term discrimination and at times, especially I see in the aging community, lack of competent, inclusive healthcare and aging services makes it even more difficult for them to feel trusting of healthcare providers, or really to have options. When as a traditional aging adult, you have many options. You can look at lots of in-home aging in place options, many care communities, but for an LGBTQ plus older adult, there are not a lot of inclusive care options. And this can be difficult. This can be challenging and frustrating and hard. Makes aging even more difficult. So again, you see many people in the community assuming poor treatment or discrimination, having that resistance, having also along the ways dysfunctional habits and ineffective coping. And you see just really an elevated rate of more emotional, physical, and mental health challenges than heterosexual older adults, and elevated rates sometimes of using substance abuses for coping, and poorly managed anxiety and stress along the way. So all of this comes together and impacts, sadly, self-neglect, grief and loneliness, lack of support, fear, mistrust, and then again, holistic health and wellness challenges, because you do have a lack of preventive health problems. And sometimes you have just crisis management having to come into play to really assist when there's just no other option, which is hard, and it's sad, and it's just not the best way to handle things. We also see a lack of estate planning. We see health disparity and long-term care challenges and economic hardship impacts. People aren't accessing, really the social welfare programs that could provide them with more, and other areas that could really make aging much easier due to the past. So some things that I see in my practice, and things that we're trying to really impact as clinicians anytime we can through education and other programs, are really, having more options for LGBTQ plus aging, for services and affordable housing. And really making sure that we don't have a detriment in terms of inclusive long-term care services and options, helping people to understand what that looks like, so we can prevent these severe health and wellness challenges, and really impact rates of economic security and other scarcity of support services aspects. So we really want to try and really halt the dysfunctional cycles that we're seeing out there, because it really is presenting with many challenges across the board for many individuals. So breaking that cycle, how do we do that? Well, through education like this, helping people to understand where people have been and what we need to do. And how can we do that? Through education and application of learning, by really creating inclusive, person-driven programs for support. And again, acknowledging the past, understanding what people have lived, and really appreciating that by preventing hate speech, educating, halting marginalizing, and creating safe and accepting spaces. Oftentimes when I do educational talks, I hear from other people, we're doing everything. We treat everyone the same at our care community, or we treat everyone the same at our senior center. And they don't realize that really that's not what we're asking for. That's not person driven. That is marginalizing. We need to appreciate the very individualized aspects of that individual, and help them to realize that we acknowledge them, we see them, and we understand. So along the way, we want to consider also this cumulative and overlapping impact of historical trauma and microaggressions upon this community, and how it has created holistic health to those in multiple marginalized populations across the community, and really concerning the intersectionality and interconnected nature of all this, and how it overlaps them as an aging individual, and how we can embrace simple pieces and really influence by taking more of a trauma-informed approach across, because trauma really is one key consideration here, and it is for many individuals. So, I think I'm going to try and make sure that you come away from this with a clear understanding of acknowledging the trauma in these individuals' populations, and how it intersects with their experiences as an aging individual. And hopefully by talking about trauma-informed care a little bit today, also, you can apply that to other areas in aging, because many of us have trauma, and it does intersect across, how we age and how we relate to others. So the key here is really to think about, when you're focusing on services, you're focusing on care for LGBT older adults, is really in terms of communication. We're going to talk about that a little bit more. Environment, having a welcoming environment, and then organizational initiatives to foster change. And then applying, again, I'm going back to that trauma-informed approach, because I think it really is important, so that individuals can help to create resiliency and to avoid re-traumatization. So what is trauma-informed care? Hopefully many of you have heard about this in the past. It's a concept drawn from psychiatry, and it asserts really that past experiences of trauma have impacts on current health. And it kind of is sort of like, no kidding. But really it shifts the focus for individuals intersecting with others in healthcare and service, environments, to what's happening or what's wrong with this, from what's wrong or what's happening with this individual specifically, to what has happened to this individual, and how do we understand that as it impacts today to move forward. So accepting that trauma truly does influence the effectiveness of all human interactions and services is really important. And sometimes we don't really think about this. We're busy, we're rushed, we have time limits in terms of our patients or in providing services. So sometimes it helps to take a minute and back up and think about this and try and apply it, because really a solution-based service approach, recognizing, how trauma is impacting others is really important, and creating a culture and organizations that view and respond to trauma in the best way possible is going to have better outcomes for individuals. So again, trauma-informed care or trauma-informed approaches, we seek to realize that, of course, widespread trauma will really impact multiple paths in multiple areas. Understanding the signs and symptoms of trauma in patients and family members and others is really important, because it does help us to better address what's going on now and to move things forward in an effective way. And integrating really a clear understanding of trauma and trauma-informed approaches into organizations will help really to safeguard and support good policies, good procedures, good practices, and really actively avoid re-traumatization and affect and impact positive outcomes for people. So again, acknowledging that service providers need to have a complete picture of an individual's life situation, both past and present, is important. And we need to be able to embrace this all with a forward-moving, holistic wellness approach, holistic service approach, to be able to effectively impact care in an individualized way. The past and the present are all important. So why do we need to understand this, and how do we apply it? Because it's important for everyone to recognize just how common trauma is. Again, you saw in really how I approached Edith Windsor in the timeline, of her life, and just imagine how much trauma Edith probably experienced across her life. And really, by not being able to live authentically, you find people trying to be resilient in the LGBT older adult community. They've pushed this down. And eventually it really does start to bubble up and become dysfunctional in terms of coping and adapting. So we want to understand this, and how we can, as service or healthcare providers, understand and take this significant history of inequities across many areas and impact it and move it forward in a better way. Because again, we know not just in the LGBT community, but severe trauma contributes to oftentimes holistic health disparities across many, many areas. So again, acknowledging the past impact the future, and recognizing trauma. Some common holistic concerns, do come up across many areas. And understanding the impact of identity-based trauma on general health and cognition, and providing really just the basics in terms of emotional safety. Safety in a safe environment is kind of the basic start of all of this for supporting a trauma-informed approach. And then really the next is communication. And really you're communicating and reinforcing safety initially by forming trust. And this does take time. And then, of course, continuing to create that safe environment, but creating a predictable environment, giving the individual control, choices, by having collaboration on all aspects, and giving them then autonomy and fostering a respectful relationship. We're trying to support resilience through this and giving them the tools to be able to move forward to create some stability. So there's 5 principles: safety, choice, collaboration, trustworthiness, and empowerment. And ensuring, again, that the physical and emotional safety pieces are handled for the individual is really the first step, along with communication and trust formation. And you'll see across sort of this little schematic a little bit about that in terms of safety, choice, collaboration, and more, and some definitions for this, and then some principles in practice. Really, making sure common areas are welcoming and privacy is respected, giving some nods that you are a welcoming and safe space for those in the LGBT community. Making sure that individuals are provided with clear and appropriate messages. Continuity is key. And making sure they understand that you're respecting their rights across everything in terms of privacy and other aspects. Collaborating with them, having them actively participate in their plan of care, their service plan, and other areas, so that they feel comfortable that you're not telling them what has to be done, but you're allowing them to make changes and choices based on options. And then being respectful throughout, and maintaining proper boundaries. Sometimes through communication, you can do this very well in terms of collaboration and forming trust. If a person feels resistant to answering a question, giving them more time. And again, throughout, just providing an atmosphere that allows individuals to feel validated, not marginalized, not the same as everyone else, not a cookie cutter approach, is really important to be able to impact and make positive changes. And then, of course, throughout all this, we want to avoid re-traumatization. And what does that really look like? What is re-traumatizing? And it's really a situation or an environment or a trigger that resembles an individual's past trauma, literally or symbolically. And it can then bring about emotional feelings, difficult feelings, or even reactions associated with the original trauma. I'll give you an example of this. And sometimes we can't avoid these things. So learning about the individual that we're working with in a service industry, healthcare provider industry, whatever, is important. Again, understanding where they've been and where they are now and how that impacts, the future is very, very important. So that being said, and I apologize, something is ringing on my office phone. So understanding that is going to be important, and I want to give you sort of an example of that. I had an individual client who we didn't realize woke up during abdominal surgery. This individual didn't recall it initially, but then when they were in an elevator that did a similar ding, ding, ding to the monitor during their surgery, they passed out. Over time, we worked with the individual, and some of the past came up, and they were able to just process over time these feelings and understand what had happened through a lot of counseling. So these are some of the things that can come up that we don't even realize can be triggers. So we were very careful with that individual moving forward, because we realized, yikes, going back to a hospital could be a trigger. Lots of things, even a doctor's office. So we arranged for a visiting physician in the home who understood inclusive care for safety. And then we slowly worked on that process moving forward along with their input. So oftentimes, re-traumatization is not intentional. We don't mean to do it, but the more we take time to be active listeners, the more that we learn, the better equipped we can be to provide individualized services and care. So some things that we can do to promote health, in an LGBTQ plus older adult, some basic things we'll know from their history or from talking with them that, really having an inclusive environment that really shows them it's physically and emotionally safe is going to be important. Having a safe space sign, this is a welcoming environment. All these things that show them visually and in processes that this is a safe space, it is okay, is really going to help to foster some trust initially. And again, establishing trust is important along with autonomy and choice. So collaborative relationships and participative opportunities are going to be key. And it does take time because over time, we want to be able to call upon their strengths. Even when they're having significant challenges, we want them to recognize what their strengths are and help to build on those and empower them to move forward in the best way possible, to promote resilience and also to promote really participation in their care so that they start wanting to move the process forward in the best way possible. So no matter where we are on the continuum with the individual, we want to give them realistic tools and support to be able to move forward, to stop these cycles that are dysfunctional. Here's just some information on retraumatization, some things that can hurt along the way. Again, being marginalized, being treated as a number, that makes people feel that they're not heard, they're not valued, and it violates at the core of the person trust. So we want to make sure we're not doing those types of things. We want to make sure that if someone is a transgender or intersex individual, that we're being very, very careful about procedures that require disrobing, because we don't want them to feel a failure to ensure that we understand and we support their emotional safety and their sense of choice and their sense of collaboration and throughout all of this. We want to make sure that we give them choices in terms of treatment and services. And that's something that we need to expand upon across aging, because I know even in Northern Virginia and across, the DC metro area and beyond, there's still areas where there are not a lot of choices for geriatric services, assisted living, and others that really foster an inclusive care environment, that really have individuals that have sought out stage credentialing or other mechanisms to make sure that they're staying on track with understanding the needs of LGBTQ plus older adults. So we do want to make sure that we are fostering all of these aspects and applying these concepts into practice by respecting and supporting a physical and emotional safe environment and confidentiality, taking time to listen, asking questions and building trust slowly. And when a person hesitates, saying, it's okay, you seem like you don't feel comfortable with that question. We can come back to that if you want. Asking about individuals that are important to them. Some LGBT elders do not connect with families of origin. Asking who's important to you? Who is your chosen family? And establishing consistent boundaries is very critical to have clarity in terms of what's expected, what are going to be tasks that are going to have to be discussed or done, and what really needs to be discussed collaboratively. What are their choices? Person-driven processes are very important with active listening, trust building, eliminating triggers, and fostering really a safe collaborative environment. It goes without saying, but I am going to say, really make sure that you identify and use proper pronouns, avoid gender language, ask questions, get clarity, use open-ended questions with no pressure, and don't rush. It's hard. We're in fast-paced environments, many of us, but it's important to take the time. Respect confidentiality in all aspects and reinforce to them how this is done and be consistent. Allow them to set the pace in terms of progressing language, progressing the relationship, the trust building, and all communication. And by all means, do your best to not stereotype. Do not stereotype or single out individuals based on appearance, mannerisms, and do not marginalize. Acknowledge their feelings and help them to understand that they're being heard, that you recognize them as an individual, and focus on strengths to empower to move forward. Some phrases to consider. I'm not going to go over all of them, but again, tell me about who's important to you. Am I using the correct pronoun? to address you? Is it okay to use this in this environment? How do you identify or self-identify? Is it okay for me to ask you this? Do you feel comfortable with this? Making sure that you use considerate phrases, open-ended questioning that slowly builds trust. Some other areas to support, again, creating an inclusive environment. What does this look like? It can take many forms. You don't have to have a rainbow flag at the center of your building or your entrance, but designating this as a safe space through all aspects of your environment. It can be decor, but it can be also through programs, acknowledging special events for all individuals, or having classes that are for all women. Just really making sure that your individual planning and the creation of policies and procedures are inclusive at the core, and having these policies, procedures, forms, and regulations checked really with individuals in the LGBTQ plus community being involved and asking their input. Talking to SAGE or SAGE Care at the national level, who are experts in this, to avoid having hiring policies or orientation of new employee programs that aren't really actively meeting those needs. Having employee and client forums that allow individuals to answer honestly and thoroughly. Same with patients or for service provisions. Fostering a positive culture, actively, but in a positive, appropriate way, deterring negativity and hate speech, and finding a way to ensure that service providers are aware of past trauma of LGBT individuals, and ways that we can be sensitive and understanding of this so that we can foster positive changes. Because really, by educating team members, by actively incorporating inclusive environments, policies, procedures, forms, and other aspects as a part of your whole organizational culture, we can impact the holistic health, wellness, and correct these inequities by advocating appropriately for equal care, treatment, and services. So some closing thoughts, because I do want to have enough time for some questions, and I'm almost over my time period for that. Listen, use inclusive language, avoid gendered language. Look up what gendered language looks like. You may be surprised at what you see. Recognize and acknowledge the history. Acknowledge and think about how you would feel if you were an aging LGBT older adult. Make sure that you help those aging LGBT who probably or maybe are solo aging because their chosen family are aging too, to assemble a team. Help them to link to socialization opportunities, intergenerational programs, to help them to reform that support system and to have safe spaces for holistic health and wellness. Understand the importance of cultural competency training for providers, for people in your organizations and across your community. You can be a change agent for this, to help people to understand about implicit bias, microaggressions, trauma-informed, and other culturally sensitive treatment aspects. Consider the cumulative effects of all of this and how it intersects an aging individual. And emphasize the support of inclusive care programs, inclusive services, inclusive opportunities and options for those aging LGBT, because it is important for everyone to have choices, not just a few. And consider the role of self-affirmations and ways to holistically support others, to be resilient by really helping them to form healthy, good, holistic health and wellness across their lifespan, and help them to feel comfortable planning and help them to have resources to do that they can really feel comfortable using. Because the more we do, the better it can be for individuals and this community. And also stay abreast of current news and events so that you understand what is affecting these individuals, and make sure you're factual in terms of getting that information. So closing thoughts: safe, welcoming, inclusive, and respectful gender-affirming environments are important for all individuals. Do not take a we treat everyone the same approach. This is marginalizing. Recognize how different, how special individuals truly are in all we do. Do not make assumptions about the past, the current, or the future. Remember to use preferred names, preferred pronouns when interacting with individuals. Blanks and forms are wonderful if you're not sure what to do. Allow people to self-identify and describe what they want to disclose, and never pressure or rush. We can all impact positive changes in safe spaces through making a few changes and improvements for everyone. Because honestly, everyone deserves the right to feel comfortable, to live authentically, and to age with the support that they need. So thank you for taking a moment to listen today and for trying to be a change agent and fostering inclusive services for those who are aging LGBT. Here are some sources that you can reference. And again, you can get all of this information after the program. Here's some additional resources. And finally, please let me know if you have any questions. Jillian, I think we're ready to take some of those now if you would like to facilitate this.
Sure. Thank you very much, Karen. I think that was an incredibly informative and important presentation. So we have a question from a Bonnie Dozier, and I'm sorry if I'm mispronouncing your name, Bonnie. Would a trauma qualify as a PTSD diagnosis?
Yes, we see a lot of individuals with PTSD, and yes, it does qualify in many ways, and it's important, as you probably know about post-traumatic stress disorder, to be able to form trust so that steps can be taken through proper counseling and therapy to move the individual forward. And I really recommend that you involve the individual specifically, and by giving them choices, allowing them to look over choices for counseling and therapy, and then discussing that with them so that they feel a real comfort level in being able to move forward and transition through that. Yes.
Okay, thank you. That's the only question we have in right now, but please, attendees, if you have questions, please submit them using the Q&A box. We have a few minutes. I will also be sending out in the follow-up e-blast to attendees Karen's contact information if you think of anything after the webinar that you would like to ask. I will go ahead and pose a question.
Oh, I'm so sorry, Jillian.
No, you're okay.
And also, someone did ask, what is my background of work?
Yes.
I'm a master's prepared nurse, RN. I was trained in the past also as a nurse practitioner, but I do not practice as one because I've been doing care management for years. I own a practice called Eldementals LLC. We do complex care management for all ages with a large focus on dementia, cognitive impairment, and complex conditions for older adults. And also for obviously individuals in the LGBTQ plus community who provide services and support for all. I'm also the founder and director of an organization, not-for-profit, called Aging Rainbows. And we do a lot to help with education across the Northern Virginia area and beyond on what inclusive care looks like, how you can provide that in your organization, and also fostering intergenerational programs and support and resources for those aging in the LGBT community. So that is my background of work, to answer Laurel's question. And if someone does have a question, you can reach out to me. I know Jillian will provide my contact information. We're always happy to provide educational programs to groups and others, and to answer any questions. If you have a question about, are my forms looking, does this look okay on my form? Are we doing this the right way? Or how could we do this better? You can always reach out to us. I also encourage everyone to check out SAGE and SAGE Care online. SAGE provides a credentialing program so that your organization can ensure that they're staying up to date with being an inclusive care provider and understanding the needs of those in the LGBT community. So SAGE credentialing is something that you can seek out and look into that online through SAGE and SAGE Care and the National Resource Center on LGBT Aging.
Thank you, Karen. My question that I was going to ask, and you touched on it a little bit, but in the instances in which access to caregiving is limited and informal caregiving via family or family or friends is more applicable. How do you, what is the best way for us to address the fact that many members in the LGBTQ plus community do not have the same level of family support in many cases? What forms of, methods of spreading awareness can work best to help these individuals that already have limited access to informal caregiving?
Yeah, I think that that's a very good point. So there's things that you can do in the community to just make sure that individuals understand that you are safe and welcoming. And a lot of times I myself and with Aging Rainbows and Elementals will collaborate on community programs such as Sage Tables. A Sage Table is an event that really invites anyone from the LGBTQ plus community and those who are allies to come together. And sometimes it's a potluck, and oftentimes, we oftentimes provide food, but it's an opportunity without pressure for people to kind of gather and get together. And sometimes you'll have people that are service providers, elder care attorneys, and then people from the LGBT community coming together and just having an opportunity to talk and socialize and have something to eat. So having just kind of community open programs without pressure, I think is oftentimes really nice. Having programs that stress this is for all women or all individuals is nice. And really just trying to create some safe spaces without pressure. Doing this in senior centers, community centers, having it through community health and wellness fairs, open houses, collaborative events like a Sage Table event, so that they see the name Sage and they say, wow, this is something that's a safe space. And then bringing in intergenerational components. Because the big challenge is that people aren't planning to age. They don't have a team. And if we can help people to grow their network by having programs that they come to and feel comfortable coming to, it really helps them then to slowly build on, feeling comfortable going to a pride event, or feeling comfortable then because they talked with an elder care attorney at a Sage Table or a safe event, can help people then to slowly layer on these pieces. And also offering just educational programs in safe spaces, bringing in outside vendors, for example, long-term care planning, and holding that perhaps through a PFLAG event or at a safe space. Through a Sage credential provider, or through in collaboration with Aging Rainbows or another organization. Even, a great organization is Casa Brumar. They're doing amazing programs, and we often support and collaborate through them. So bringing a safe space and extending out so that they have those resources to build trust, I think is a great way to do this. Does that make sense?
Yes, most definitely. It's really all about building the community.
It is. And the more opportunities that we show a safe environment and bring in outside parties to expand the intergenerational components, the long-term planning components for health, wellness, execution of proper documents for their safety, and to have their express wishes heard and acknowledged, is so important. So,
well, thank you very much, Karen. I don't see any further questions, but again, I will be sending out Karen's contact information along with the presentation slide decks. I saw a few questions about that. That will be going out in just a few days with a link to the webinar recording, which is on our Governor's Conference YouTube page, which is linked in the chat above. But if you have any questions, feel free to reach out to me. I'm going to drop my Governor's Conference email right here. But yes, stay tuned for keep your eyes peeled on your inboxes for that follow-up email, and feel free to reach out to me even if you have suggestions for future webinars. I will hopefully see you all next month for our next webinar. But thank you very much, Karen, for your incredibly important presentation and for your time this afternoon.
Oh, thank you so much, Jillian. And if there's something that I didn't cover, please feel free to reach out, because there's a lot that can be covered and it's sometimes hard to put it into 45 minutes. So feel free to reach out if you have an additional question.
Thank you, everyone. Enjoy the rest of your afternoon.
Thank you. Take care.
Bye.
Bye all.